welcome to Home Solutions. My name is Terry. We are pleased you've chosen us to help you meet your therapy goals in the comfort of your home. For a complete overview of our services and what to expect, please watch our Home Solutions introduction video. Your doctor has ordered medication that we deliver to you along with the necessary supplies. We also coordinate a nurse that will arrange a time to visit based on your dose time. This video will show you how easy and safe the steps are for administering your ordered therapy. When your nurse arrives, she or he will teach you in depth everything needed to safely and effectively complete your therapy plan. So let's begin. Home Solutions will usually deliver your medication and supplies on a weekly basis, but this is based on the stability of the medication once we mix it. Some therapies are delivered monthly. Your Home Solutions care team will let you know the plan for your specific therapy and coordinate delivery times with you. The medication will be labeled refrigerate if it requires such. If you are getting multiple medications or therapies, please check each one to see which does or does not require refrigeration. The pre-filled flush syringes and other supplies to care for your catheter do not need to be refrigerated. We supply everything you need to take care of your IV catheter and infusion medication. Many of the supplies provided are meant for the nurse to use. Each time you get a new shipment, you will want to use the older medication first, but never infuse medication that is expired. If there is a concern about your medication or the packaging or containers appear damaged in any way, call Home Solutions immediately. Do not use. Check your medication label for your name, the correct medication and dose, as well as the expiration date. Saline is sodium chloride or salt water, which is fluid that is in our bodies naturally. And heparin is an anticoagulant or keeps the blood from clotting in your catheter. It will be flushed into your line as the last step in your infusion process to keep your line patent or open and ready for use for the next scheduled dose. Depending on your catheter type, you will use either SASH or SAS. Your nurse will help you understand which you should follow, and the pharmacy will provide the heparin if it's ordered. SASH simply stands for saline, administer medication, saline, and heparin. SASH is the acronym to help you remember the order in which you will use each. Home Solutions protocol for all catheters except a portacath is to flush twice a day, per lumen, and a lumen is a single pathway. Some catheters have multiple fluid paths. Each fluid path or lumen must be flushed twice daily. If heparin is ordered, it will be 10 units per ml heparin in the blue cap, or 100 unit per ml heparin in the yellow cap. A nurse will review what protocol is specific to your catheter. Your dosing schedule is determined by several factors. How many times a day your physician ordered the medication, when you received the last scheduled dose prior to coming home, and what time your next dose is due. At each dose time, you have 1 hour before or after that dose time to infuse your medication and still maintain the levels in your bloodstream to be successful on your therapy. So if your dose is due at 8 a.m., you can infuse any time between 7 a.m. and 9 a.m. Your specific schedule will be reviewed by your nurse. Usually the prearranged schedule for the delivery and a nurse to arrive is planned around your first scheduled home dose. Let's set up your supplies for your infusion. The home pump is a container shaped like a balloon or ball that is filled under a sterile environment by Home Solutions with the medication that your doctor has ordered for you. The home pump has a tube leading from it that you will connect to the end of your IV catheter. The rate and time it takes for your medication to infuse is determined by the size of the home pump. There is a number on the round filter located midway down the tubing and at the top of some of the home pumps. This should correlate with the therapy rate that is written on the label. If it does not, stop and call your pharmacy staff, who are available 24/7. Now that you understand how your medication is dispensed, let's begin by reviewing the steps necessary to successfully complete your infusion. You will have pulled one home pump out of the refrigerator approximately 1 hour before your scheduled infusion time in order for the medication to reach room temperature. If you have forgotten this step, do not attempt to immerse the home pump in hot water or place it in the microwave, for this will compromise the integrity of the medication. If you do not allow the home pump to reach room temperature, the dose time will take longer than the home pump is designed to deliver. Once you have verified that all the information is correct on the label, you are ready to infuse your medication. Let's gather the rest of your supplies. You will need your medication or the home pump, alcohol swabs, one for every time you will connect something to your catheter, 2 normal saline syringes, and 1 heparin syringe if heparin is ordered. After you have laid out your steps, take your first alcohol swab and scrub the IV catheter injection end cap well. 20 vigorous scrubs is minimally recommended. Your IV catheter injection end cap has a rubber-like end and is a one-way valve. The valve prevents air from going in or your blood from coming out. There are no needles in this process, and all connections attach with ease using a push-twisting-like motion, a Luer lock system. Prepare the first saline syringe for injection by releasing the air out of the top of the syringe. Remember that once you take the cap off the syringe, it is sterile under there, so don't place the cap down on a dirty surface and put it back on the syringe, and don't touch the end of the syringe. Take the first saline syringe and push, then twist it into the end of your IV catheter that you just cleaned. If there is a clamp on your catheter extension set, you will have to unclamp it in order to get the saline to flush through. Using the push and pause method that the nurse will demonstrate, and after all the saline is flushed through, untwist the saline syringe from the end cap. If you have the type of catheter that does not require an extension set, the end cap can accidentally be removed. So make sure you're holding the end cap securely as you twist the syringe. Our extension sets have the end cap locked on, so this will not be a concern. And using the same scrubbing method, take your next alcohol swab and repeat the cleansing process of the end cap. Take the end of your home pump tubing, remove the plastic cap or piece from the end. It is sterile under the cap, so make sure you don't touch anything before you attach it to the injection end cap. Then push, then twist it into the end cap exactly the way you pushed and twisted in the saline syringe. In order to infuse the medication from the home pump, you will need to unclamp the white clamp located in about the middle of the tubing. You do not have to hang your home pump because it infuses under pressure, not gravity. So you may place it in a pouch or on a nearby surface while you are infusing. We recommend you have a timer or alarm set while it is infusing. This prevents you from getting involved in something and forgetting to check on it. Just be careful with the tubing that neither you nor anyone else pulls on it. When your medication home pump has completely infused, it will appear flat, and when you are ready to disconnect. Clamp the home pump tubing and disconnect it from the end of your IV catheter. Be careful to not disconnect the end cap. Use an alcohol swab before attaching the remaining saline, followed by heparin if ordered syringes. Once you have successfully flushed your line as ordered, the last step is to make sure the clamp on your IV catheter is closed if you have one. Anything that does not have a needle, body fluids, drainage, or hazardous medication can be thrown away in the regular trash. Place the empty syringes in the trash. Your nurse will review this with you. We provide a red sharps disposal for situations that do require needles, such as drawing lab work. Keep this out of the reach of children, so choosing a place to keep your supplies is very important. We will exchange the sharps container when it is 3/4 full, so please let your care team know so your next delivery can include the new one and take away the old one. A member of the Home Solutions care team will contact you weekly or monthly, depending on your therapy, to discuss your supplies, gather some additional information helpful to the clinical team, and arrange your next delivery. If you have added any new by mouth or other types of medications, including herbal, it is very important that you let us know. If you have a PICC line, use the white protective sleeve included in your supplies. This can help secure the catheter that is outside of your body and an extension tubing. Regardless of your catheter type, it is important the dressing remains clean and dry. Looking at your catheter site daily to see if any complications are present is important as well. Some of the complications could be things such as redness or tenderness at the insertion site, and the insertion site is where it goes into your body. Any drainage at the IV site, pain or swelling at the site, or in the arm or shoulder it is in. Inability for you to flush the line and never force it, or if your IV catheter dressing is coming off or gets wet. Make sure you have our number in a convenient location, as well as a nursing agency's number if it isn't Home Solutions nurse caring for you. Whoever is providing your nursing service is the agency you need to call for any catheter-related concerns or questions. If you have any questions or concerns, you may contact the Home Solutions branch servicing you 24 hours a day, 7 days per week. The number will be on the labels and is provided for you in your patient packet of information, including a magnet for your refrigerator. Adhering to the plan of care discussed by your nurse will help you reach your therapy goals. If you miss a dose, please let your Home Solutions care team know as soon as possible. If your physician ordered lab work related to the therapy we are supplying, your home nurse draws them from either your catheter or your arm. Several factors determine where we draw from, and this will be determined by your care team and discussed with you. If the medication you are on routinely requires lab work prior to a certain dose, the nurse will schedule this day and time with you. If you are on an IV antibiotic, it is important that you do not dose prior to them arriving to draw the labs. And it is imperative, if you have missed a dose since the last pre-dose lab draw, that you inform the nurse and pharmacy. This can cause your medication level to appear too low, leading to an increased dose recommendation, when in fact, it should not be adjusted. Your nurse will discuss any other considerations needed for your specific therapy and lab draw needs. Your nurse might be one of Home Solutions or one from a nursing agency from your community. This is usually determined by your insurance, your choice, needs other than IV such as wound care, or someone your physician or hospital transition of care team designated. If it is not a Home Solutions nurse seeing you, please make sure you have both our numbers and theirs where you can easily reference. We coordinate with and assist our community agencies when they are involved. Medication compliance is an area your entire clinical team is concerned with. Our pharmacists and patient service representatives need to know any changes to your medications. This includes all medications, over-the-counter, herbal remedies as well. Your nurse will review side effects of your medication that you should alert your physician to 24/7. You have a pharmacist available that can answer questions about your medication and work with your physician care team to resolve any concerns. Step-by-step instructions for performing the steps discussed are included in the packet of paperwork Home Solutions provides. We take pride in providing exceptional care with respect and consideration for your needs. If at any time your patient experience is less than desired, please let us know. We value your feedback and are committed to making process improvement an integral part of our organization. We at Home Solutions welcome you to our family and thank you for choosing us as part of your care team.